Okay, we're back, and I'm here with Dr. Simpson. Good morning, Dr. Simpson.
Good morning. How are you
doing? Nice
doing?
to meet you.
Yeah.
And you are with the Jackson Creek Dental Group.
That's correct.
That's here in Jackson.
Yep.
And we're going to be talking about denture implants.
Yeah, implant retained dentures.
Okay.
Yeah.
Well, tell us about that. When would someone need to consider these implants?
Well, traditionally dentures have been a replacement for when you lose teeth.
Right.
Probably the most common cause of loss of teeth today is periodontal disease. When you lose the foundation for your teeth, so the bone actually resorbs and your teeth start to become loose. And we can fix decay, things like that, but when you lose the foundation, then you don't have much choice.
Now, for periodontal disease, is that something that is hereditary, or
yeah, there's hereditary
can it be prevented
factors.
just by truly taking care of your teeth, or are those people who take really good care of their gums, but they just have...
It's certainly a lot better understood now how to manage it so that we can reduce it dramatically. There's far less people, there's about half as many people with dentures today as there were even 5 years ago.
Yeah, we were talking about that.
And so periodontal disease can be controlled with good oral hygiene habits and regular visits. But in the case where you actually end up having to replace teeth, either through trauma or advanced decay or periodontal disease, traditionally what we've had to do is things like bridges, where we prep down the teeth on either side of the space and then we make a bridge and then we would cement that on. But you're talking about prepping down possibly perfectly good teeth to do that.
Right.
And cleaning underneath it can be difficult, things like that.
Right.
Plus aesthetically, it may not look as nice as a tooth that emerges from your tissue rather than actually sitting on the tissue.
Right.
Okay, so to go with something where you actually have an implant that comes out of the bone.
Right.
Similar to this here, where you'd have an implant in there, and then here we have a bridge that we would actually put into the implants. Where this is actually kind of a large one here, maybe for an elephant. Big tooth. But this is essentially what you get put in there. And believe it or not, I've had many people tell me that having an implant placed, it sounds terrible to have a hole drilled in the bone and stuff. They've said it's easier than having a filling done.
Wow.
And the pain afterwards, especially today, now we're able to do a lot of them without having to lay any flaps or anything, thanks to guided surgery, where we actually place it on a computer. We can place an implant in on the bone. We take a 3D scan of your jaw. We place the implant on the bone on the computer, and then a lab makes a guide for us to place that implant in. So
once someone gets these dentures, these implanted dentures, what's the maintenance for it? Do they need to continue to return to the dentist to have some maintenance done on them?
Well, an implant can certainly get periodontal disease. They call it perioimplantitis. And so you do have to keep it clean. So once you actually have the implant placed, there's a couple of options here. You can see this one stays in really good. So this would be like a traditional denture, but this denture is being retained by a couple of attachments that are placed inside the denture. And so this allows you to have, instead of a denture that's floating around, especially the bottom
so you don't
ones,
have to put that cream and all that stuff on it.
Because the top ones you get good suction if you have a well-fitting denture. But on the bottom there's no suction to be had, so everything has to be retained by the ridge. And when you get your teeth out, you no longer have forces on the bone, and so the bone resorbs over time. They say you lose about 40% of the bone in the first 6 months after having your teeth out, so in bone height. So you develop a space underneath the denture. That can be relined, but still over time you lose more and more bone and get less and less retention. So this works really nice to retain that.
Interesting. Okay.
Now what we're going to, though, in many cases where we'll actually place 4 implants like this, and this is actually screw retained. And so this is actually one here that shows...
I like the clear where you can see through and see what it looks like.
So this is an actual patient that has had this done, and this is an actual jawbone that has been reconstructed from the computer.
Wow.
And the lab then puts the implants in there, and then this is the type of attachment we would put on there. And this simulates the gums. And then they make this appliance so that when they come in to have these implants placed, They place them in there. This is pre-made ahead of time. We're able to screw this on at the time of placing the implants, and I've had patients go home that night, have steak sandwiches and everything.
Wow. And it looks like you can match the upper to the lower. If, say, you just need the upper teeth, you can match the color to the lower teeth or get close.
Yeah. So that's the kind of guide we use to actually place those implants.
Interesting.
Works really great.
We've come a long ways technology-wise. It's amazing. So, how long of a procedure is this?
Well,
hours or?
Oh, like this procedure
to
here?
have this
Yeah, this
procedure
is
done.
about 2 hours to do this, if you do 4 implants. To do 2 like this, it takes maybe 45 minutes or so. Very simple procedure. And even people that have almost no bone left can still have the one done here.
Yeah.
Because there's almost always bone in the chin. So this is a really nice solution for people that already have dentures that want some additional retention. So.
That's good to know. So if someone's out there and they have dentures, maybe they've had them 10 years or so, this is something they should consider. It's newer technology. It sounds like it's easier to care for them. And
this is pretty inexpensive now too, because we actually have single piece implants now instead of 2-piece, and that reduces the cost quite a bit.
Just curious, dentures, are they sometimes covered by insurance? Or?
Oh, yeah.
Oh, okay. Well, that's interesting.
Dentures are almost always covered.
Okay.
Implants some of the time.
Medicare covered them?
No, not implants.
All right, that's all the more reason to get a supplement plan then.
Yeah, that's right.
Okay, let's just remind our viewers real quick. You're located here in Jackson, across from Taco Bell?
Yes.
Okay.
Yeah, Jackson Creek Dental Group, big brick building on the left side there as you're heading out of town.
All right.
So,
well, thanks
great.
for being with us. Stick around in the show, and we'll remind our viewers of where you're located and what your business does. For now, we're going to transition over to Cam, who is with Stuart Lighting.
All right, very good.